Good afternoon. Welcome to UAB's Town Hall for Students. Today we're going to hear from senior leaders. Afterwards, we'll open it up to Q&A. Just a reminder, we are recording the session and it'll be available later on UAB's YouTube channel. With that being said, I'd like to introduce Dr. Watts.
Thank you very much. Well, it's a pleasure to be joined with you in this town hall, and the real purpose of these is to keep you as informed as possible. We want to provide the best transparent information to you and our entire UAB community, because being informed helps you be a proactive advocate for safety measures. Fulfillment of our multifaceted mission is vital, but we still always put your safety and health as our top priority. And I want to thank you for your active involvement over these first 3+ weeks of the fall semester. It's gone very well. There were a few little technical issues at the beginning, but all of our students and our faculty and staff have adapted well. We know that rigorous adherence to our safety measures and appropriate human behavior work to control the virus and the infection rate. We have, over these last 6 months, brought our entire clinical enterprise back to 100% activity. Our hospital is full. We're managing 60 or 70 COVID patients effectively, and that's down from 120 a few weeks ago. So the clinical enterprise is at full steam. Our research enterprise is essentially at full capacity. We brought that back over the last 3 to 4 months, and it's going well. And now our educational enterprise has been successful in our first 3 weeks. I learned a couple of days ago that again this year we're going to achieve record enrollment. It's going to be over 22,500. We're up about 500 additional students. But we must maintain vigilance at all times on and off campus, because most of the infections that have occurred out in the community. The daily health check gives our Instant Command Center a daily up-to-date sense of the health of our entire student population and our faculty and staff. So 40,000 plus on a daily basis. We're working to keep that information. So if we see that there is an infection or something, there's a cluster, we can address that very quickly and early. We've only had 200 and some odd students be positive for COVID since the very beginning, back in March. So we are among the lowest of any university in the nation, especially for our size and the complexity of our campus and our academic medical center here in the city of Birmingham in Jefferson County. So thank you for all you're doing. Keep it up. Don't let your guard down. We want to have a full fall semester, and we want you to be as successful as possible. And we're excited to have you on campus or studying virtually and being part of this record-breaking year. With that, I'll stop and turn it over to Dr. Pam Benoit, our provost.
Hello, thanks for joining us this afternoon. I want to start by congratulating you on your resilience in adapting to very changing circumstances. The feedback that I'm getting from students and from faculty is that classes are going well, that students are doing exceptionally well, even under very difficult circumstances. So we all appreciate that. We know that everyone is working as hard as they can to continue to try to accomplish their dreams. And as President Watts said, the message I think today is vigilance. We've done remarkably well compared to a number of other higher education institutions, but we need to keep that up. And I'll remind you, there are several things we're asking you to do right now. 1, wear your mask indoors and outdoors. 2 is to do social distancing, not to gather in large groups, not to get too close to other people right now. 3, as the president said, health check. Make sure that on a daily basis, you're filling out your health check so that you're thinking about what your symptoms look like and you can get information. We can do what we need to do with you if you have symptoms. 4 is sentinel testing. And sentinel testing is that we select a random population and ask them to come in to be tested. That allows us to see where the spread might be on campus. So if you get one of those emails that asks you to do sentinel testing, please take the time to do that. And lastly is exposure notification. There's an optional app, but it allows you to indicate whether or not you've had a positive so that other people around you can also be notified, and we can do a much quicker contact tracing than by using other methods. So again, vigilance. Vigilance is the key word. Make sure that you're continuing to think about ways to keep yourself safe, to keep your faculty safe, to keep your fellow students safe. Thank you so much for everything that you're doing. Dr. Faircloth.
Thank you, Dr. Benoit. Welcome, Blazer students and parents. I am Mike Faircloth, the medical and lab director for and a physician within UAB Student Health Services. I am fortunate to have been asked to participate on and continue to serve several health and safety task forces and committees, both at the UA system and UAB campus levels. Since the beginning of this pandemic, it has been very clear to me that the UA system and UAB institutional priority is the health and safety of its students, staff, faculty, and visitors. UA system and UAB campus leadership provided a goal of setting the standard for health and safety, and this has been accomplished through developing a plan grounded in evidence-based science and medicine, thereby informing the decision-making and recommendations at every step of the process. SARS-CoV-2, the virus that causes COVID-19 illness, is a new virus, but the public health principles that define how a community and individuals can most effectively respond to this challenge are not new. They are time-honored and grounded in that evidence base mentioned above. The resulting recommendations and plans align with these principles and apply to all students, faculty, and staff, and include some of the things you've heard. Education about COVID-19 and the protocols related to that, the initial and ongoing symptom and exposure monitoring through health check, sentinel testing, critically important, which is a systematic random testing of a % of all on-campus students and staff on a weekly basis to help define the background asymptomatic positivity rate and identify early trends and other data related to the virus, which would then allow prompt action as appropriate. This testing is voluntary for the general student population, but for those in on-campus housing, clinical students, and in registered student organizations that will hold in-person meetings with 10 or more folks, again, it's required. But please keep an eye on your email for a sentinel testing invitation. And if you get an invitation, please get tested. It is a powerful tool in the arsenal in the fight against COVID on our campus. Some of the other basic critical required measures mentioned, the social and physical distancing, the masking, proper hand hygiene, and remaining off campus if you're ill for any reason, and identifying those who are ill, positive for COVID-19, or have significant exposure, and quickly isolating or quarantining to prevent the spread of the virus. Again, these are sound public health principles, and when followed diligently, as is required and expected on the UAB campus, are effective measures to mitigate exposure to and potential illness from COVID-19. The pandemic is fluid and knowledge continues to rapidly evolve. We are fortunate to have many renowned experts in medicine and public health regarding COVID-19 right here on the UAB campus, and their expertise and guidance have been and continue to be critical to decision-making processes, ensuring that the UA campus and UAB leadership are best prepared with meaningful and current data. A couple more critical points I'd like to mention. Firstly, if, based on your symptoms, you need to be COVID tested, here at Student Health, neither you nor your insurance will be charged for COVID testing. We offer both the rapid point-of-care antigen test, which results usually in 30 to 60 minutes, and we also collect the molecular genetic PCR that we send to a partner UAB lab that usually results in about 24 hours. Secondly, we are again entering the cold and flu season, but this year in the time of COVID. Getting a flu shot has always been an important preventative measure, but this year the importance is greatly magnified. Unfortunately, flu and COVID-19 symptoms are very similar, and this makes clinical differentiation and decision-making more difficult, and provides the possibility of concurrent flu and COVID-19 illness. So please get a flu shot as soon as possible. Student Health will receive our flu shots later this week, and once received, we will broadly share that message and the process for coming to Student Health to get a shot. Some of the outside commercial entities, such as CVS, Walgreens, Publix, and others, are already providing flu shots. So please take advantage of all the available resources, with the important thing being get the flu shot wherever that might be. Student Health Services is open to serve you, our students, both on-site, in person, and virtually, and we will continue to be available throughout this challenging time. We offer an on-site laboratory and radiology services and an immunization clinic. We're open Monday to Friday, 8 to 5, and you may schedule appointments through web booking through your Student Health Services patient portal or by calling 205-934-3580. We are also provide on-call services from a clinical medical clinician every day of the year, 5 p.m. to 8 a.m. Monday through Friday, and throughout the weekend. There is no such thing as no or zero risk, but with the outline planning and protocols, the UAB campus is absolutely working to provide the safest campus in America. Thank you. I'm going to pass to Dr. Michael Sagg.
Thank you, Dr. Faircloth. And hello, everybody. I'm Mike Sagg. I'm Associate Dean for Global Health in the School of Medicine, and I'm also Professor of Infectious Diseases. So I want to talk to you about something that's been mentioned a couple times now, and that's the notion of sentinel testing. And as background, we know that this virus is out in our community, and that's been plaguing us since late February, early March. The virus is really pretty simple to understand. All it wants to do is find somebody to infect and do its business. And our job is to keep it from doing that. And you've heard already multiple references to mask wearing and keeping distance and trying to stay safe on campus. One thing that we're doing that I think is really important is this concept of sentinel testing. So you ask the question, what is that and where did it come from? I think the word goes back to guards outside of a fort, say, for example, keeping watch to see if any foreign threats coming up. And I liken it immediately to Hamlet. Those of you who are English majors can follow me on this. But in the play Hamlet, the very first line of the play, or the very first opening scene, is a sentinel guard looking out, keeping watch, trying to see if somebody's going to attack the castle. And he hears the rattling of chains from Hamlet's father's ghost off stage, and he turns really to the audience and says, "Who's there?" And that notion of who's there to a ghost is really, I think, what's metaphorical for us doing sentinel testing, because this virus is out there, but we can't see it, yet we know it's there. And so what we do is we use sentinel testing as us standing on guard to monitor the campus and see who might have become infected. And if somebody tests positive, we can see if there's a hot spot emerging that we can address and take care of before it becomes more widespread on campus. How does this work? Well, we have actually everybody registered, faculty, staff, and students. And then we randomize, we pick about 3 to 5% of the entire population a week. And just by chance, like a flip of the coin, we pick somebody. Now, it's interesting for students, you're in your own group. And even if you're in a residence hall, you might be different than, say, an athlete, or different from somebody else who's not living in a residence hall. And each one of the subgroups is randomized within themselves. If you get picked, you'll get an email, as has been alluded to, and you'll be asked to come and get tested. The testing will be on campus, and you'll go to the website and where you get the link, and you'll click on location and pick a date and a time. You go in and get tested. It's very simple. It takes, once you get there, less than 5 minutes. It's very fast, and you'll be doing your part. You'll be doing your citizenship for not only yourself, but for the entire campus. So it's really important that we monitor that. Dr. Watts and others have said how well we've done so far, and we have. But this virus is still lurking, and it's still going to take all of us together, all of us doing our part every day. Sometimes this randomization may pick the same person 2 weeks in a row. And that can happen just by chance, as what randomization would say. I would say that person should go out and buy a lottery ticket because they got lucky twice. So that would be a good indication that you get picked twice, something's going right for you in randomization. The final point I'll say, and we'll happy to answer questions about any of this, is we've talked about wearing a mask, but let me just kind of make something crystal clear. When you put your mask on, it has to cover your nose and your mouth. That wearing it like this isn't going to cut it, and putting it under your chin, you've got a mask, good for you, but it's got to be worn properly, because what it's doing is if you happen to be infected and you're breathing or even talking and even more shouting or singing, you're sending out a cloud of virus into the immediate area around you, usually about 2 to 3 feet. When you put the mask on, that reduces by about 90% the amount of virus that you otherwise would be putting out. And that 2 to 3 feet around you is why we ask for 6 feet of social distance, because that makes it relatively safe for everybody in the environment. So I'm hoping that by understanding some of the biology and maybe a little bit of Hamlet, we can come together and continue to keep our campus safe. It's an everyday event. It's an everyday thing. The virus is going to be with us for a while, unfortunately, probably through the rest of not only this semester, but the entire academic year. So let's get ready for it, keep it going. I'm real proud of not just the faculty and the leadership, but all the students who have really taken this to heart and done a great job. So thank you. Thank you very much for everything you're doing, and let's keep it up.
Thank you. Thank you, Dr. Sack. That was great. We'll turn it to Q&A. So if you have a question, feel free to drop it in the Q&A, but I'm going to start with pre-submitted questions, people that submitted questions to us earlier in the week. And we'll start with always a hot topic in these town halls, but about residence life. So Mark Booker, these questions are for you. Several students have questions about why do we have to move out of the dorms at the end of the semester? And then a follow-up, do we have to take, if we have to move out at Thanksgiving break, why do we have to take our things out?
Thank you, Rosie, and thank you for the question. First, I want to start with props to Dr. Sag for calling them residence halls. Well done, Dr. Sag. You can look for your check in the mail. Appreciate that. In addition, I think it's important that we all understand that as several of our panelists have alluded to, no one is exactly certain about what will happen between November and January. And so in preparing for that, we tried to make it very clear that it would be best for people to bring fewer items with them when they return for the fall, in anticipation of knowing that we will move out fully in November. And then we will determine at that point what the spring will look like and whether we will begin on January 11th or whether that date could potentially be extended or delayed. So we think it's best. We learned a lot in the spring when students did not take their items home and their property home. They got home without chargers or laptops or things like that. And so we think it's best at this time for everybody to take everything with them when they do leave in November. If you have if you have a circumstance or a hardship that would prevent you or you need to stay on campus for access to Wi-Fi or for other reasons, we will have a few spaces available on campus for students to stay between November and December. Thanks, Rosie.
Thank you. Keeping on the topic of coming back to school and living on campus, someone asked, for those of you who are currently living out of state, how soon before the semester starts on January 4th is it best to move back to Alabama? So maybe Dr. Benoit, if you wanted to take that, or even Mark.
So let me say that we're currently in the process of thinking about the spring semester. We hope to be able to make an announcement relatively soon about what we might do going into January, now that we've gotten past the hump of the beginning of the fall semester. So look for additional information that would come to you via green mail about the course of the semester. Right now, it looks very common at other universities that they have delayed their starting dates, that they have decided not to do a spring break. One of the difficulties with spring break is that when you go into other communities and you come back, you have the greater potential of bringing infection back to the campus. So all those things are part of the discussion that we're working on. We're listening to the experts as usual about the best choices we can make that allow us both to protect health and safety and also provide a quality education. So stay tuned for spring.
Great, thank you. Several people have asked about graduation this fall. So wanting to know, will graduation be held at the end of the semester? And will there be safety guidelines put in? So I'll let you answer that, Dr. Benoit.
So there will not be an in-person graduation in December. We are sending students home at Thanksgiving to continue remote instruction for a week of instruction and then a week of exams. So the last thing we would want to do is to bring those students back to the campus in an in-person way. We will do a virtual celebration of those who are graduating from students. We encourage you to put together a video. We have some wonderful ones that were shared in our previous celebrations, and we'll be asking you to do that again.
Thank you. I think I'll ask this one for Dr. Watts. Why is UAB hosting football games when they aren't even allowing student organizations to host events off campus?
Well, we put in place the same safety measures that we have on campus at Legion Field. Everyone must have a mask before they can enter, and everyone must socially distance. The good thing is that stadium has 70,000 plus seats, and our average attendance last year was 20,000 or so. We had our first game Thursday night a week ago, and everyone behaved in a very responsible manner. I can tell you, if we were to have any spike in infections and or any inappropriate behavior, we will limit the spectators, and we might even not have any spectators. So if everyone wants to continue this experience, our athletes are being very responsible, or being tested 3 times a week. And we know that everybody on the field is COVID negative within the 24 hours beforehand. But in the stands, we've got to have everyone be just as serious about safety as you are in any other setting. So it's a privilege for us to be able to have these, and that privilege can only be maintained with appropriate behavior and without any danger to the safety of our students.
Great, thank you. A student asked, what kind of feedback are you getting from parents and students about how the hybrid model is working this semester? So I'll pass that to Dr. Benoit, and maybe Dr. Sloan might want to weigh in as well.
So I'll start and say that we've gotten some very positive feedback from students and from parents, that people are trying very hard to provide a great experience, that there's a lot of creativity going on in the classroom, and that the different varieties of delivery have been useful too. Some students really relishing in an in-person experience for some of the courses that they're taking in there as well. So there are a variety of ways in which we have tried to make this a good experience. The technology is working particularly well right now. As always, whenever you're making a change, there are new ways that we can improve, and we'll continue to work on those. One of the things that we heard from students was that faculty put their Canvas syllabi together in different ways, and we're trying to provide some guidance about that for faculty for next term. Dr. Sloan, you might comment too. I know you've had some really good experiences in your classrooms.
Yeah, I'm teaching a 9-credit hybrid course Monday, Wednesday, Friday, 9:05 to 12:05, and so I have a different group of 37 students each of those days, and students seem to be enjoying it. Attendance is basically full. Students are showing up for their in-person class days and enjoying it, and we've worked out a good system whereby we take questions and comments through the chat feature for those online. Not all faculty are going to be real savvy about Canvas. Some of them, have traditionally taught in-person class only, and maybe fall is their first time doing, remote or hybrid. So I'd ask students to kind of be patient. I sent out feedback asking our students, who are a lot more tech savvy than old geezers like me, about, what can we tweak, can we improve? And so students shouldn't be shy about suggesting in a positive way suggestions to faculty that are maybe struggling with the new technology and format delivery. And so, don't be shy about making positive, constructive suggestions. You probably have a lot more expertise than the faculty using these formats and new technologies. So, so learning experience for a lot of faculty. So, be patient and offer constructive suggestions about how it might be improved. That's what you're paying fees for.
Dr. McMahon, I know you've also had some good conversations with graduate students. Do you have more to share here?
Sure. I have had some really positive feedback from graduate students. I met with a group of graduate student leaders last week and asked them to share their experiences, both positive and negative. And I will say that they had almost all positive comments. They haven't been enjoying the instruction. They are seeing how hard faculty are working, and they appreciate the innovation. The one comment that I did hear that they thought could be improved was already mentioned by Dr. Benoit, and that's related to the Canvas shell and where faculty are placing their syllabi and their reading assignments. And so we're working on that. We will work with faculty to see if we can make that easier for students. Thanks.
Great, thank you. All right, turning to some of our tools to keep us safe, Health Check. Dr. Carver, I'll let you take this one. Is there a way to download Health Check to our phones or create a shortcut on our phones in such a manner that we do not have to enter our Blazer ID and password each time we complete Health Check?
Rosie, that's a great question, and a great question from the students. Yeah, that is in the hopper of things that we want to do really within the next 30 days. Our current focus is strengthening the resiliency of the current health check. We're looking to have that, all of those steps implemented in the next 2 weeks. We're then moving on to building a health check for visitors to protect the visitors and protect all you students when we have visitors on campus, so that everyone is following consistent. We think we can do that very quickly too. And then the third thing is what you asked for. We're going to build Health Check into the UAB mobile app. Within that app, you're already authenticated in, so it already knows your username and password. To do so, we have to build what are called APIs. They're just programming interfaces against Health Check that we can then link the mobile app into. So it's coming soon. It'll be here in October. No more logging into Health Check. You'll just be able to access it from a tile inside the UAB mobile app. It's a great suggestion, great idea, and we're already working on it.
Thank you. Now turning to parking. So Andre, I'll give this question to you. A student talks about being in a deck in which there's a lot of open spaces and they have a remote parking pass, but they have to wait several minutes for a bus due to restrictions. They mentioned tensions are high at the shuttle stops. Can anything be done temporarily about being given tickets for parking in deck spaces that won't be used anyway due to reduced business operations?
Great question, Rosie. We are actually, be on the lookout for an announcement coming out very soon where we will be allowing students for a very nominal exchange fee, basically just to cover the cost of the permit itself. We'll be offering students an opportunity to switch parking zones. So that announcement should be coming out in the next week or so. And the process will be very simple. You will simply come in and exchange your permit for the new zone that you request, and that will help alleviate that problem.
Thank you. Several questions came in about tuition, like pricing. So Dr. Benoit, wondering if you could just address, why are people still being charged, full price, even though they feel like their classes have gone to hybrid or remote? Why isn't there a difference?
So I think one of the misnomers about online instruction is that it's cheaper. It's in fact much more expensive. So it requires a lot more investment in technology. It requires investment in the hardware. We also, in order to be able to provide hybrid courses, had to do a lot of work with facilities in order to make those accessible. In order to make Bartow available to students, we had to also put Wi-Fi, make Wi-Fi better there. Faculty are still working full-time, no matter what the delivery mechanism is, and that's a major part of the expense of delivering the instruction. And so we continue to try to provide a really great experience. And in order to do that, we need to have funding to be able to provide that. Most classroom buildings are still being fully utilized. They're still being fully cleaned. A lot of the normal expenses of being able to make the university go are still in place.
Great, thank you. An individual asked about flu shots, that there's a misconception that getting a flu shot too early is bad because it wears off. Is this true? Could anybody answer that question? I know our president is a physician, so Dr. Watts or Dr. Sag?
Well, I'll take a stab at it. So
Okay.
the flu shot does work for sure for about 4 months, and then it does tend to wane. So if you got your flu shot, let's say this week in mid-September, by January into February, it may start to wane. So there could be another recommendation for another shot sometime then if we see flu seasons going on. But one thing I forgot to mention, there's one at least silver lining to COVID. And that is, if we all wear a mask, that prevents COVID, but it also prevents flu transmission. So if we do masks and flu shots, we may have one of the lightest flu seasons we've ever had if everybody does it. So that's what I would encourage everybody to do. The flu shot is definitely important, as Dr. Faircloth said, but we'll be monitoring the response to this year's flu shot. And if there's a need for a second shot, we'll let you know that. But right now, the plan is just for one.
Great, thank you. A student asked, once the vaccine is approved, will students and staff be required to get vaccinated? Many, like myself, are a bit skeptical of receiving a new vaccine, especially if it's rushed because of presidential orders. So I'll give that to Dr. Watts.
Well, I think that we all want to see an effective and safe vaccine. And I am encouraged that all of our leadership at the NIH and CDC and others have vowed that we will not prematurely approve a vaccine because of any kind of political pressure one way or the other. So we hope to have at least one, but maybe more than one vaccines that could be available in the first or second quarter of 2021. But rest assured that we will not recommend or use anything that's not backed up by the very best of science.
As a follow-up question, someone wants to know, will UAB offer free flu shots in January as a booster? So Dr. Faircloth or Dr. Sag?
Well, I would just say that if there's a recommendation for a second flu shot, then I'm sure we'll do all that we need to do to make sure everybody gets it. Right now, I was simply just answering the question from a biologic perspective, and we won't know that for another, really till January, February, how the vaccine response is holding up. But so it could be that there is a recommendation to get a second one, and I can't imagine a scenario if it's recommended that we wouldn't find a way to make sure everybody got the vaccine they needed.
That's right. You can rest assured on that.
Thank you. An individual is asking about the education building. Will it be scrapped in the spring? They've heard that Dr. Benoit expects the spring to look like fall. So do we not need the education building for students to use for in-between classes and remote learning? Dr. Benoit?
This is a great question, and it begins to hint at the complexity of making changes in the schedule. So I did say in a previous town hall that I anticipate that in terms of delivery methods, we will look very much like we did this fall in terms of offering in-person, hybrid, remote, and online course offerings. The education building has been very useful to us this fall because we needed some places to have students in between classes. But it is scheduled for demolition after Thanksgiving. And the reason it's scheduled for demolition is because this is the location for building a new science and engineering building that will also in the future serve students. So as we work through the schedule, we'll be looking for additional spaces for students to study and to be at places in between classes.
Right.
And let me also add that the education building required no additional technology to be available for usage by students to study and to connect via Wi-Fi and into the internet. So we have outfitted, though, since then, Bartow and Alice Stevens Center and other buildings that will provide more than enough space for our students to have access to their computers and study. That education building will be taken down, as Dr. Benoit said, and our new science and engineering complex, this will be the first building, and it will house the departments of biology and physics, both research and educational laboratories and classrooms and offices, but also educational classes and laboratory for chemistry as well. The second building of a 3-building planned complex will be a new School of Engineering building, and that will follow shortly after the first science building. So we will begin that process in early 2021, the building of the new building, and it will probably take about 18, possibly 24 months. Is Greg Parsons on with us?
He's not here today, and I regret not having him here because somebody's asking about the Humanities building as well. So,
well, let me just go ahead and address that a little bit too then. We had planned to take the Humanities building down, but there are important facilities for the Department of Art and Art History, and there were the need for classrooms since our enrollment has continued to grow, and some of those classrooms are being used this fall. I don't know a definite about when we will take that down, but it will probably be within the next 12 months or so. And originally we'd always planned to take it down and put some green space there and save it as a site for a future additional new building. Our campus master plan is laid out to continue over the next 5 years. Right now we're completing our newest residence hall, and it will be done by October or so. And we also are completing the new information technology building, the IT building, across from the School of Health Professions on 9th Avenue, across from Student Health and Wellness Center as well. And the School of Medicine has some research buildings planned, and we have other buildings planned. The School of Education has moved into the wing of what used to be the Business Engineering Complex. Now it's the Education and Engineering Complex, or Engineering and Education Complex, and that has gone well too. They moved in right before campus. The new Honors Hall for the Honors College was finished just a month or two ago. They're still working through getting that up to full speed, but our campus master plan will continue to unfold, and a lot of excitement for the future.
as a follow-up, Dr. Watts, somebody's asking about Gold Hall. When would that be completed?
Well, that's the new freshman residence hall, I think, is being called Gold Hall. Is that right, Mark?
No, sir, it's Green Hall. Gold Hall is the
Green,
one
okay.
Yeah, that opened
Okay.
in 2015. Green is
Okay.
the one that's being constructed right now.
It will be finished by mid to late October is what I've heard. And we will be getting that up to full speed. As you may know, there will be a new dining facility there, and that will be an important addition, as well as some other kinds of activities. But yeah, that's a state-of-the-art residence hall, and we look forward to bringing it on board full-time, probably in the spring semester.
Thank you. Keeping on that notion about residence life, a question has come in, Mark, student asking, will they be in the same rooms, I'm assuming, next semester?
Yes, for the most part, students will return to their same residence hall. They may not be in the exact same apartment or suite, except for those students who opted to or have requested or will be assigned to Green Hall, as we've been talking about. Once that opens in January, we'd love to have students occupy that, as Dr. Watt said, state-of-the-art residence hall. Very excited. It's our only LEED residence hall on campus, and it will receive a LEED certified silver rating, which is related to sustainability. So we're very excited we were able to design that in as well. So a long answer to a short question, but to the extent possible, yes, they will still be in the same hall.
And are international students being charged to stay on campus over the breaks?
Well, I don't intend to single out international students per se. Any student that needs to stay between November 20th and the beginning of spring, there will be a charge to remain in the residence halls for that period. So all students who remain will be charged, yes.
Okay. And a student is asking, when will fraternity events be allowed? I'll pass that over to Dr. Mary Wallace, maybe.
Sure. So right now, student organizations, including fraternities and sororities, can host on-campus in-person events if they meet the programming guidelines for both indoor and outdoor events. We have put a moratorium on off-campus events, so those things should not be taking place. We will review that when it's safe to do so. And so right now, those are the event guidelines in effect. And as it gets safer, we will look at those guidelines.
Great. We're down to one question here, so if you have a question, feel free to submit. But Eric Burtz is asking, how has UAB benefited from the pandemic? Construction space, new departments, recognition? I think that's an interesting question. I'll let Dr. Benoit and Dr. Watts maybe talk to that.
So I would say the one that immediately comes to mind is that it's really highlighted the expertise on our campus in medicine and in public health. And we've become leaders in providing information and being part of clinical trials. I think that it's pretty amazing how much we have been a leader in being out there on the front talking about COVID. We also, I think, have really done a great job of implementing technology in our classrooms. And as a result of that, we now have lecture capture installed in many more classrooms than we did coming into the fall semester. And that, I think, will prove very helpful going into the future as well. Dr. Watts, do you have other comments?
Well, I think that we're so fortunate to have world-renowned physicians and public health experts like Dr. Sag, who has been at the forefront of the fight against HIV and AIDS for, I guess, 25, 30 plus years. And he brings that same expertise, and his colleagues in the Division of Infectious Disease and its director, Dr. Jeannie Marasso, are some of the most outstanding faculty in the world. Same in other parts of medicine and in public health and health professions and informatics and IT. Everybody's worked together to put together a platform for this campus that has made us the safest or one of the safest in the country. And having a world-class academic medical center coupled with a world-class research-intensive university has really put us at the forefront as a model of trying to do everything possible to continue to fulfill our mission, which is the largest mission of any institution in the state of Alabama, because of course we're providing a world-class education for you, but we're doing research that's changing the future. And we've got a lot of research in COVID and COVID vaccines and COVID treatments, and our physicians and nurses and others are using the very latest technology. Our Department of Pathology developed our own highly sensitive gene PCR test back in March when we couldn't get tests from anywhere else. And we ended up testing all of the returning college and university students in Alabama, and that was done primarily through UAB Hospital and the School of Medicine. So it's shown resiliency, but I think also in the digital world, it's made us, it's forced us to move forward, both with our educational, instructional activities, and much of the work of our health system and the School of Medicine and the Health Services Foundation has been through telehealth. And it's revolutionized our use of telehealth in taking care of the many patients that we have who spread across the state. So some of our physicians are managing dialysis patients in South Alabama or Central Alabama using telehealth. So it's really pushed us forward. The good thing is that the governor and the legislature, because of so many needs for education to be provided virtually, have set statewide Wi-Fi and connectivity as a top priority for the legislative session coming up. So if we have good Wi-Fi and good internet connectivity across the state, it will benefit everyone. It'll benefit education, of course, but it'll also make the reality of having very effective telehealth, even in rural areas, a reality. And so I think it's pushed us to use technology in more ways than we have before. And all of that will improve the overall delivery of all parts of our mission. So, and I will tell you that I have been extremely proud of everyone at UAB and the teamwork that's been exhibited, and the selflessness and the willingness to work 24/7 for many weeks and months to really do everything possible to serve our UAB community, but also to serve Birmingham and Jefferson County in Alabama. And the work that our researchers and leading physicians are doing will affect healthcare around the world. So there are a lot of positives, although it's been an unprecedented pandemic. And the sad thing is that over 180,000 Americans have died because of it. And we're going to do everything we can to help solve it and work with others to help solve it as soon as possible.
Thank you, Dr. Watts. We had a couple of questions come in, so I will wrap up with these questions. A student is asking, what are the chances that spring and summer classes will be offered as hybrid or remote, and will students be able to elect strictly remote schedule through DSS? So I'll let Dr. Benoit speak to that, and then Allison Solomon, you could follow up.
I said earlier that I anticipate that the spring will be much like the fall, which means that there will be 4 different ways in which classes will be offered. There will be in-person classes, and we prioritize classes like labs, performance classes, classes for freshmen and sophomores, honors courses, courses that really need an in-person component. And those classes are prioritized for both in-person and hybrid instruction. And then we'll also be offering some classes in a remote or an online format. So just like the fall, I anticipate that will be very similar going into the spring semester, given the information we have now on public health. I would encourage you to consult with your advisors about your schedule so that you can pick the kind of classes that will advance your schedule and help you to complete your program.
Allison?
Yes, so for students that need to request temporary adjustments related to COVID, there is a process students can follow on the DSS website. One thing that I do want to clarify, the question I think said, can students elect to do remote classes through DSS? And I just want to make sure to clarify that students must meet a criteria that we've developed. So those criteria are that a student is either COVID positive, a student meets the CDC standards because they're higher risk due to COVID, or also they live or care for an individual who's considered higher risk per CDC guidelines. So I just want to make sure that that's clear, and to follow that process, you can go to our website, uab.edu/DSS, and there is an application process to request those adjustments through our website. And feel free to call us if you have any questions to provide more clarification. Thank you.
Thank you. We've had a request to repeat the flu vaccination information. So Dr. Faircloth, if you could maybe repeat when flu vaccines will be available from Student Health.
Yeah, we were supposed to get our first supply tomorrow, but the hurricane has affected that, but it still should be within a couple of days. So we expect it to be this week. As soon as we get it, we will begin making it available the next day. So whatever day that is this week, we will broadly message that to all students and begin giving that the next day.
Okay. All right. Well, and just one quick follow-up there. Are students recommended to get the flu vaccine from wherever they are, like CVS, and not just rely on student health, or only student health?
Yeah, I would recommend getting it wherever you can get it. I think even some places like Publix, if you get it there, they give you a $5 gift card. So you actually can go some places and get paid to get the flu shot. But the important thing, the message is get the flu shot, wherever that is. We're glad to do it here at Student Health and here to do that. But if it's more convenient for you to do it at an outside place like a CVS or Rite Aid, please do it wherever is most comfortable for you, but just get it.
Wonderful. Thank you. I think we have hit a record here and completed questions in a town hall before the town hall time was up. So, but with that being said, I'll pass it to Dr. Watts and Dr. Benoit for closing statements.
Well, I hope that you can tell and recognize that everyone is doing everything possible to help you get a great education in the safest environment possible. COVID is with us and will be with us for months and maybe years to come. We know how to deal with it effectively and how to limit the spread of the virus, but it depends on the appropriate behavior of each and every one of us in making the right decisions to always follow these known and proven safety measures. So please keep up your vigilance, stay safe and stay well, and we're looking forward to continuing great fall semester.
Thank you.
And I would echo much of what Dr. Watts said. Please be safe. Think about your own behavior, because that influences the behavior and the conditions of others. And so go Blazers, and keep up the good work in your classes.
Thank you all. This ends our session.
Okay, thank you.
Okay.
Have a good day.